This week's Ask Dr. Durie is from a patient who is concerned about the ongoing COVID-19 pandemic and asks, is this pandemic over? The unfortunate answer to this question is no, we're not quite through this pandemic yet. Unfortunately, there continue to be some variants or sub-variants of concern. There is this variant called BA2, which now has some new sub-variants, including BA2.12.1. It's getting really quite complex. The issue is that the sub-variants continue to be more infectious. This BA2.12.1 is 25% more infectious than the previous one. And so this is producing increases in disease. In the past, we've had major surgeries. Now, the increases that we're seeing across the country are a little bit less, and that's why we're using this term waves instead of possibly surges. However, we are concerned that there are some new variants of concern emerging in South Africa, including BA4 and BA5. And these are worrisome and really the last thing that we want to be hearing about, but the reality is that this is happening, and we just need to be prepared to be protected. And so for myeloma patients, this means that we can't throw away our masks just yet. Masks are just so important and do protect you, especially where there may be mixed groups, some people wearing masks and some people not wearing masks. It's important for myeloma patients to wear the best masks possible, the N95 or something similar, and this will protect you, particularly in closed spaces or with gatherings. Obviously, it's so important to be vaccinated and also to get one booster and then two boosters, that second booster, when you're eligible. If you're concerned because of your disease or possibly the type of treatment that you've been taking, that the antibody response to the vaccination is not good enough, there is now available the antibody treatment, the intramuscular shots called Evusheld. There has been some concern about the availability of this, but now it does seem that it is available. However, you may need to talk to your doctor and search around to see which pharmacy does have a supply of the Evusheld. If perchance you do get some fever or you end up getting tested and you find that you do test positive for COVID-19, it is extremely important for myeloma patients to follow up right away because there is early use antivirus treatment. For example, Paxlovid is available as a by-mouth treatment, and there's also Resvemivir, which is also available as an intravenous backup. And so it's important to remain cautious and be aware of those things, be cautious about travel in public transport. I do recommend that myeloma patients should wear masks on planes and in airports and buses and trains. This is quite important. Just maintain these cautions to try to stay as safe as possible. And so bottom line, unfortunately, the COVID-19 pandemic is not gone just yet, although it's morphed into something which, because of all the tools that we have now, is much more manageable. And so do pay attention to the status of the COVID in your own local community and make adjustments to your habits and plans to stay safe.